Good afternoon, everyone. Welcome to another Sunday session. As usual, this will also be a two-part session. So I request you to join the second part using the same link. Today we have with us Dr. Parth Soni. Dr. Soni is a psychiatrist and hypnotherapist. He has 7 years of experience in the field of psychiatry and de-addiction. Currently, he is working as a consultant psychiatrist and de-addiction specialist at Alpha Healing Center in Gujarat. He has presented several oral papers and posters at various national and international conferences. He has also participated in numerous mental health awareness programs on TV and radio. He has also given multiple talks and guest lectures on de-addiction at various social platforms, schools, and colleges. Apart from de-addiction, he is also working towards suicide prevention. Today, he is going to be talking about balancing life post-COVID. That said, I request Dr. Soni to kindly take it forward.
Hello.
Yes, sir.
Yes, I'm audible.
Yes.
And can you see the screen?
Yes, we can.
Okay. So I would like to start with acknowledging Dr. Vyas and Pooja for giving me this opportunity to speak on this topic. Why I chose this topic also because me and my family also had suffered from COVID and recovered well recently only, as well as it has taken some toll on our health also, as well as our various aspect of our life also. But why it is important after in this situation to balance our life and what should be done, I will be talking on that and giving you some key points how to do that. So 2020 was the year where multiple things specifically related to COVID happened, and that led to various issues like working from home for constantly so many months together, children staying at home, not going to school, handling them, tackling them, various day-to-day activities getting affected. Many restrictions were posed by the government for the safety. Health facilities access was limited, and only in emergencies people were taken into treatment part. Also, there was multiple fears associated with it. But now, since 2021 has arrived and vaccine, we are almost all healthcare professionals are taking it and making them safe. So this is the year of opportunity, and I would say the recover the growth, recover the issues that we had during that year. So as we all know, this was a public health emergency and it still continues to be so. In Mumbai right now, also the situation is very critical as we are seeing. Also, there are few new strains which are coming, and all of this leads to stress reaction as any emergency situation would come. So COVID is a public health emergency, and in this today during these situations, stress is a normal response where uh, we have to do many things which we are not used to do, and because of the stress there are various symptoms that people face and go through. In the physical aspect, they go through breathing difficulty, palpitation, chest pain, headaches, body pain, and all. At the level of psychology, where they feel restless, inability to relax, anxiety, panic situations specifically related to news coming up about new and new things, new and new variants, restrictions, and all. Along with that, boredom, anger, frustration. So these feelings are also very common. Also, there are many cognitive difficulties and challenges that they come along with stress. They are not able to concentrate well, forgetting things, negative thoughts, worries, feeling of hopelessness, because we are not able to control the situation. And behavioral issues, the most significantly affected area where excess use of tobacco, alcohol, mobile, laptop, Netflix, and so on. People spending hours together on this. So all of this led to multiple challenges of their own. Along with the crisis, these situations will create more and more challenges, and which might lead to various other psychological symptoms, including anxiety and worries, as well as uh, becoming more and more obsessive towards checking towards whether I have the symptoms or not, whether this I have cold, it might be COVID or not. So many things affecting our life, disturbing various physiological function and leading to negative consequences. Many people have lost the job, salaries were reduced, the work from home was there, where promotions got delayed. So these patterns also negatively affect our cognitive thinking process also. And all of this lead to serious problems. And the patients who had contacted COVID, they go through various emotional symptoms also, like what if I have to be hospitalized, what if I would not able to live longer, I have comorbidities like diabetes, hypertension, blood pressure, and I have to be extra cautious because of it. And the family members thinking about the elderly and specifically pediatric population. What if they come in contact with me and I should stay away from them? This led to various issues. So what happens is, in such type of crisis situation, many things are not under control, and it leads to all of this feeling of feeling sad, angry, anxious, helpless, and stressed. So what should be done in such cases and such situation, and how can we be stable as well as try to be in the growth mindset in any situation? That is the today's topic. What should be done is controlling the anxieties, controlling the negative thoughts, emotions, and how it should be done. That's what we are going to talk. Many things we keep on thinking which are not under our control, like why did government allow people from foreign entering into our country? It should have stopped before only. Why did that particular person come into my house knowing that he has cold or cough or headache or fever or something like that? Why did government did this? Why did schools were not open, or why did early opening of schools were done? Why did healthcare system does not have much ventilators? Why was the flights still kept on for so many months after the COVID was identified? So and so on. But these things are not under our control, and most of the time we spend on thinking these things, and which ultimately lead to no significant outcome, no significant change in our thoughts, and it lead to more and more anxiety and worries because they are outside our control. But the things which are under our control are that we should be focusing on, like what should be my routine, how will I tackle myself if a person in my family or in my neighborhood is suffering from, what should I do to help them, meanwhile preventing myself from getting infected. How can I improve my immunity? What can I do to reduce the anxiety and negative thoughts? How can I depend on trustworthy news and not listen to the rumors, and how can I prevent spreading the rumors? So these things are under our control. So focusing on the things which are under our control, that will help us to tackle this crisis and stress associated with the COVID. Coming to the physical aspect, what can be done to maintain a good physical health during this crisis is absolutely eating good, nutritious food, homemade. I think COVID has taught us that we can survive very well for months and years on homemade food, even though we might not like it, but we can survive and we can enjoy also. Also, physically, we can keep ourselves engaged gyms were closed, multiple fitness areas were stopped, but still at our home we can engage in a physical activity of our choice. Nothing else is possible, and walking also is a very good physical exercise which boosts up your immunity. Sleeping well, taking proper sleep, not staying up late till night, right? And specifically, if we are on medications, then continue taking medications rather than stopping them, thinking that okay, I'm normal and I don't need help without talking to a doctor. What are the don'ts that we should not follow? Junk food and drinks should not be taken and avoided as much as possible, as well as alcohol, tobacco, and other addictive substances, which are absolutely dangerous to your physical health. That will these do's and don'ts will help us to balance the life of the physical aspect. Main part of the session, psychologically, what can we do to stabilize our mind? Basically, mind controls the body, and if mind is stable, body is also under control. To do that, first of all, accepting the situation makes it as a challenge, and then we try to overcome that challenge. Many of the times we don't want to accept the situation. No, this cannot happen to me, or this should not happen, this will not happen. And we try to deny the truth, which can lead to multiple conflicts in the mind, because we know this is the truth but don't want to accept. So accepting the present situation as a challenge and try to overcome it will lead to, like, we are solving a puzzle or we are trying to manage a difficult situation, when we know okay, we can do it, but we have to give as much as thoughts, as much as positive outlook to the situation. Many methods are used: breathing exercises, yoga, meditation. There are very good online classes happening towards this. People are teaching each other, doing voluntary services, very good tools. And that helps a lot in stabilizing and balancing the psychological aspect. Hypnosis, I think I don't need to introduce hypnosis to the audience. Dr. Bhaskar Vyas, Pooja, and everyone has been promoting it, and it is a very good tool for mind. Um, Another very good aspect that can stabilize and balance our mind is reading good books which can inspire you, which are humorous, which can help you to tackle the situation well. And another good part is gratitude. If we start looking about good things that are happening during our day regularly, we will be noticing that life is not as gloomy, or the situation has not become as bad as we it seems to be. Because when we see the news, most of the news are negative about the situation. So many cases, so many people dead. The crisis is worsening, this, that. But actually, many good things are also happening during the day. So if we practice gratitude about those good things which are happening, that will lead to a positive outlook. What should not be done? Yes, we all know that continuously looking towards news. Many people used to calculate the numbers in our Baroda, in Ahmedabad. Today, this many cases are found positive. The nearest was here, and this and that. This will not lead to any good outcome, specifically on your emotional, psychological health. So rather than calculating, thinking, and worrying, trust a proper authorized source, a government source, and focus on the truths rather than spreading rumors and getting anxious about them. Uh, Yoga and hypnosis, why I have mentioned specifically, is they are anyways needed not only for this crisis situation but also for a normal health, and I would say elevating yourself, your body and mind to a more and more higher level, so that the illness should not come, and they will prevent anxiety, depression, and all. So in that yoga and hypnosis, healing is not achieved by focusing on the suffering, but by empowering one to struggle harder and raising our ourselves to the higher plane. And one of the very good tools that we use is future progression, where we ask the subject to think and feel the uh, outcomes when the situation is actually happening right now. You have to imagine like that, and feel such way that I have given an example. If a smoker is trying to stop smoking, instead of criticizing or feeling thinking about bad things, okay, your lungs will be uh, fibrosed, your respiratory tract will be getting affected, you will get cancer, rather than explaining them and making them imagine about the good effects of smoking, like stamina has been increased significantly, well, you don't smell smoky, your family members are complimenting you, they are appreciating your efforts, and these feelings will lead to uh, strong conviction and help you to change the behavior. So they are very good tools for the same. Another technique very good is the think technique, where any thought that is coming to our mind, you can check it through that. The think is the acronym for true, helpful, inspiring, necessary, and kind. Means whatever the thought comes, you need to apply this filter, where you have to check whether this thought is 100% true or not. If not, then check about the facts and opinion rather than believing it directly, whether that thought is helpful or not, specifically to me or to others. If it is going to be helpful, then thinking on it will be great. But if it's not going to be helpful, why think about it again and again? Inspiring, is that thought inspiring me, or it is not inspiring? It is demoralizing. Then, if it is not going to inspire me, why keep on thinking about that part? Necessary. Many times we are preoccupied with unnecessary thoughts and things, they are not needed. So if it is not necessary, we need to think about something else that is necessary. And kind. Many thoughts might be violent, many thoughts might be, I would say, aggressive. If they are such, then focus on, our focus should not be there, but rather than thoughts which are kind, we should shift our attention there. So another good technique, which we call this thing technique, you can apply it to your thoughts to identify, and that will slowly change your thinking pattern. Because the more attention you give to a thought, the chances of it coming it again and again are there. So this was another professional aspect. I think we all know that many people have started working from home, they have changed their jobs, they have many people have changed their branches, companies and all. So to balance the professional aspect, uh, we need to have a proper schedule, even if we are at home or wherever. At home, if we are working, then have a designated space related to work only. As much as you can, utilize your time, dedicate your time to work. Suppose 6 or 8 hours or 9 hours, whatever the work time is there. Don't distract yourself while work. Also, you can have many activities that you plan, many things which you intend to do with your work, many things that you want to create, you want to contribute while you are working. So this is a good time to think on that. What are the don'ts? Don't allow yourself to be distracted while working and studying, because right now there are many distractions which are easily available and easily accessible also. So as much as possible, stay away from them. To balance the social aspect, yes, we are social animals, and because of restrictions and lockdowns, we were separated from our loved ones for many months. But yes, that does not mean we have to disconnect. You can connect with them over phone, video call, chats, Zoom meetings, everywhere, right? Also attending storytelling sessions, music sessions, visit museums, playing games, Ludo King and all games hit to a top chart during this COVID. So connection is needed, be it physical or through virtual. That should not be a problem for that. And when we are going outside, don't forget to wear a mask when you are around others, as well as social distancing, because the COVID is still there, it is not gone completely. Two aspects which I wanted to discuss. Another, which which might be not part of our day-to-day life, but if we can include them, they are very good. I would say absorbers of stress. One was the spiritual aspect, where if you are following any spiritual path, sect, if you can involve in more and more into that, you will be able to find higher purposes, meaning of life. There are many questions which can be solved. For that, you need to read, attend online services as much as possible, and meditate. That these things will be able to help you out to develop as well as improve yourself, your health also. Also, don't gather in spiritual gatherings without permission of a government. Many things we have seen because of that, health issues have increased. But if possible, as much as possible, avoid gatherings, even if they are spiritual. And another aspect which can help you also is the altruistic part. This is for the individuals whom helping others is the way to help themselves also. Many people wish and do many activities where they defocus from themselves, their problems, and try to take care of others, provide them support, food, monetary wise, provide them resources, help others, treat patients, take them to the hospital. So, if you are able to do altruistic activities, your kindness and the hormones which release during those activities will help you to stabilize your health also. But it is not for those who themselves are stressed, occupied, and affected. So if you have that area of interest and you feel good, then do take help of altruistic activities. But definitely ensure that you are following whatever the government norms are, what are the permissions needed for the same, and do it well. Right? What if all of this is not working? Then definitely take professional help. Consult the nearby doctor, psychologist, counselor, psychiatrist, hypnotherapy, therapist. They will be able to guide you. But rather than taking care of yourself by your own, if you are not able to follow all of this, then definitely ask a professional who are in a better state to help you out during such crisis situations. Uh, Take home message from this session would be, I would say, stress is a normal reaction to any emergency situation, and anxiety and worries related to COVID may be because of various reasons: health, uncertainty, when is going to this end, education, job, day-to-day functioning in facilities, when will they start, how will they start, when will we start earning as much as before, what will we do, how will we move ahead. So they might be there, but the various aspect as we discussed, the physical aspect, psychological aspect, social aspect, professional aspect, as well as spiritual and altruistic activities can help us to balance our life. And as we keep on doing regularly, it will prevent us from the future upcoming such crisis situation also, as we have a very good experience of facing a crisis now. Until now, we might not have faced such a crisis for so long duration, but now we have exposure towards that. So this might be what we can say an example or lifetime learning which we can utilize in the upcoming crisis situation also. And what should be done: correct information, healthy routine, relaxation methods, accepting the situation, not giving too much importance. All of this situation will help to balance the life and uh, take it progressive in the future. This slide I wanted to share and discuss about was again because for the same there are four types of people right now who are suffering, and all of we are suffering from the COVID-19 related crisis, right? There are first type who are thinking COVID-19 is a problem. It is making people sick all over around. It's R naught is 4, 8 something. It is spreading as fast as possible, affecting so many people, so many countries, so many deaths. So they are preoccupied with the problem part only, and they don't know what should be done, what to do, how to tackle, but just they keep on thinking about the problem. So that will not lead to any significant progress in the life, that will not lead to any improvement, and they will not be prepared, they are not prepared to tackle also, and they will lead to some or other issues of the in the various aspect of like physical, psychological, or emotional, social. So first set of people are in the problem zone. Second are fixed mindset people. Second zone, the gray area, which is shown that they are scared and worried about what is happening, but they are fixed. They don't want to change. Many people, including we have seen, there are that they school teachers, they have to now take sessions on Zoom. They are not comfortable and not willing to. What will happen to them? Eventually, they have to start by hook or by crook. They have to learn. If they don't, then they are outdated. So these type of people who have fixed mindset, don't want to adapt, don't want to change according to the situations, will find it very, very, very difficult to adjust in such crisis situations. And they will be preoccupied with the problem, but not wanting to do anything to change. The last two, the green and the blue zone, they are the ones, they are thinking it as more, what can be done to overcome this and all. So I think those who are coming over here and trying to learn, or trying to understand, we might be in the green or blue zone, where we are trying to focus on the issue, taking information about the situation, understanding what should be done, what should not be done, how to do. So, growth mindset is where we can understand about the issue, we can understand what can be done from our side, try to implement, as well as help our family members also to do the same. And fourth type of mindset are the ones who are taking this, I would say, crisis and making them into opportunity, where they can make the most of the situation. I have heard and met, I have been in contact with many people who have completed many courses, online courses during this crisis. They have never got so much free time. So they are utilizing the most of it. Many people have started cooking, they have started learning music instruments, they have written many papers, research articles, many things along with that. So they were the people they are the people who are thinking out of the box and try to take advantage of this situation as much as they can. And rather than thinking about the problem and not changing, they are identifying the problem and turning this crisis into an opportunity. So it's up to us what we see into such a situation. Any situation and any crisis is associated with multiple opportunities. It's we who have to who look for the opportunities, identify them, work for it, learn things, update ourselves, upgrade our skills. If we start doing this, definitely the crisis will be turned into an opportunity. And this might not be the worst phase, but as we already discussed, it might be a very good learning experience, and it can teach us many things that about ourselves which we don't know, the capacities which we have, which we can overcome. I quote often this example from Ramayana, where Hanuman was standing on the seashore, and nobody was willing to go over and find out about Mata Sita, what should be done. And during that moment of time, the crisis, the uh, Jambu and then other people who reminded Hanuman of their opportunity, about his potential and capabilities, that he can easily cross the ocean if he recall his abilities and he tries. Similarly, when such a big crisis comes, there is a very, very big opportunity to identify our own potentials, to grow our potentials and skills, and overcome the crisis and have a very good fruitful results. So this was the talk about. And last slide I would like to share is, which I try to remember as many times I have a challenging thought, or whenever I am in crisis. This is from, I would 12 steps where I work in de-addiction program. This is taken as the first and last sentence, and which helps us to stabilize our minds very well. This is known as serenity prayer, where we are asking God to grant the serenity to accept the things which we cannot change, such as the crisis right now we cannot change, but then accept the things. Also grant me the courage to change the things which I can. There are many things which you can change, and you need to have courage for the same. So if you use that courage to change the things which you can change, things which are under your control, then definitely the situation will be much, much better. And also grant me the wisdom to know the difference, whether this is the thing which I can change or I cannot change. So another very good serenity prayer that we can utilize in our day-to-day life also, not only in the crisis, is this, that we ask God for serenity to accept the change, accept the things that I cannot change, courage to change the things which I can, and to the wisdom to know the difference between things which I can change and which I cannot change. I think this is my contact details. If you any of you have any questions, you can ask right now also, or you can email me or contact me on my mobile. Right. I think how much time we have. Thank you so much for patient listening. If you have any questions, I would like to answer.
Thank you, sir. Dr. Vyas would like to say a few words, and if anyone has any questions in the meantime, please go ahead.
Just a minute, I cannot hear. Hello. Hello.
Hello, Dr. Paras. You were very, very good. And I think Parth, Parth is Arjun.
Yes.
And how many, apart from this excellent talk, I would like to know from you how many subjects you would have de-addicted by now.
Yes, sir. I have, right till now, we have helped around more than 500 people at our de-addiction center. And in our OPD, I would say around 700 to 800 till now in my 4 years of practice as a de-addiction specialist.
That's great, very great number. And what were they addicted to? General common cause for addiction is, I mean, common agent for being addicted to is what?
Yes. Most commonly, we have the patients who are suffering from nicotine and alcohol. So tobacco and alcohol. Suppose I would say 70 to 80% of the patients were of these two. After that, another common are cannabis. Right now, it is on the rise because of legalization and all. Youngsters, specifically the teenage population, are using it significantly.
Legalization for cocaine is in India not yet.
Yes, not yet. Legalization of even cannabis is not there in India. Marijuana.
Hmm. Ah. So how do they get it?
Sir, just like in Gujarat, alcohol is illegal, but we can get it similarly through black market.
Yes, yes. Well, uh, I have treated only one patient of alcohol addiction with hypnotherapy, and
Okay.
the fellow was a PhD in mathematics.
Okay.
And his question was that my father and grandfather both were, sorry, I'm diverting a bit from the main topic, but
No, please.
I believe you don't mind.
Yes, please go ahead, sir.
Yeah. So this young man, he said that 3 generations we were addicted to alcohol.
Right. Sir, your voice is mute.
Yeah. Now I have to get an answer in a minute, because in a minute we will be cut off.
Yes. So, sir, I cannot completely hear your question because your voice was mute. Can you repeat or?
I'm sorry, we'll have to
question
take
was
this
that I am
question later because we are almost out of time. But we can certainly have another conversation later with Dr. Soni and Dr. Vyaswan. I would greatly appreciate everyone for being here, and
Thank you. Thank you.
Dr. Soni for taking the time to give this greatly informative and insightful session. Thank you, everyone.
Thank you.
Have a nice day.
Thank you. Should we join again?
Thank you, sir.
If you want to, we can definitely join.
Thank you so very much, Dr. Soni.
Sir, we can join again if you wish to. I can after this.
Yeah, I would like to finish this story of young mathematician.
Okay. So we'll definitely join again. So please just use the same link, and we'll see you on the other side.
Yeah.
Yeah.